Our next speaker is DC and DM Sri Rajarshi Shah, DC of Adilabad district, Telangana. He will talk about the initiatives taken in the Narnoor block. This is a tribal dominated district and how the needs of the tribal majority population has been looked after, taken care of for development will be presented by Mr. Rajarshi.
A very good afternoon to all of you. Respected Secretary DRPG Srinivas sir, Director Indian Institute of Public Administration SN Tripathi sir, Additional Chief Secretary Government of Odisha DRPG Surendra sir, Additional Secretary DRPG Puneet Yadav sir, Joint Secretary Madam, all other senior officers and esteemed colleagues, a very good afternoon to all of you. I would like to thank Department of Administrative Reforms and Public Grievances for providing the opportunity to present the work done under aspirational block program in Narnoor block in the Adilabad district of state of Telangana. This first slide just talks about the Adilabad district. It's in the northernmost part of the state of Telangana, bordering Maharashtra district. And Narnoor block is interior block, around 60 kilometers from the district headquarters. And it's also near to the Maharashtra district. This aspirational block program, it started in January 2023, and as pointed out by the chair, it revolves around the strategies of collaboration, convergence and competition. So collaboration among all stakeholders through Chintan Shivers, Sankalp Saptas and self-help groups. Convergence through innovative financing and finances of central state governments, district administration, and competition which was energized through Sampurnata Abhiyan by Niti Aayog. Next slide, please. This is overview of Narnoor block. As you can see, we have a high ST population, and in the ST population also there are many tribes. So they speak different dialects. It can be Gondi, it can be Lambadi dialect, it can be Marathi, Telugu. So different dialects they speak. And another thing is, though we have Gram Panchayats 23 only, but habitations are more. So there is a tendency among the local tribes to create new habitations, which poses a challenge to provide services in the newly formed habitations. That also just I wanted to highlight through the overview of this block. Next, please. So why actually Narnoor was selected for the aspirational block program? As I told, like we have a high tribal population and different tribal groups, and particularly vulnerable tribal groups are also there in Narnoor block. When we have an idea of the social development and the human development indicators, which was just through socio-economic caste census. So as you can see in 2023, the block was performing very poor in many parameters. It can be percentage of low birth babies, less than 2.5 kilograms, so it was also high. Then NQAS certified facilities, we were not having any NQAS certified facilities. Severely acute malnourishment prevalence in children was high. Girls' access to functional toilets, it was also very low. The screening of non-communicable diseases and other diseases also was very low. School dropout rates were also high. And basic infrastructure, it can be drinking water facilities and toilet facilities in Anganwadis, that was also very low. And villages declared as ODF plus, so that was also very low. So because of these developmental backwardness, judged on the parameters of human development indicators, this block was chosen as an aspirational block, and we started this program in January 2023. Next. So I will be talking about the different strategies which we adopted and different steps which we adopted in the different sectors. First, I would like to dwell upon how did we transform the healthcare. Again, it was focused on the three pillars, and it was community-led and inclusive interventions were adopted. So for mobilizing the community, as there were huge myths and huge doubts among the local tribal leaders, local tribal communities also, particularly among the pregnant women, that why they should access the health facilities. So in order to dispel those myths through Chintan Shivers and through involving the traditional structures also, not just elected representatives of Sarpanches, but also involving the traditional structures of Gram, Patels and Nayaks, we created awareness, dispel the myths that it's important for the pregnant ladies to access antenatal care services and also to go for the institutional deliveries. So we are also showcasing the different interventions under the Jan Bhagidari, where village Patels only, they are leading and they are dispelling the myths. So because of this, it led to the 100% ANC registration in the first trimester, and also institutional deliveries also was improved. It also was achieved 100%. We do have an institutional delivery set up in the Narnur block only, but to ensure that these pregnant ladies, after their third ANC and after the fourth ANC, they do actually go for the institutional deliveries, the support of the community and the frontline workers. It was very important. So this we achieved through community mobilization and taking the help of all the local public representatives and Gram Patels. Second, creating awareness through the traditional formats also. As we told, like the different dialects are being spoken. So in order to create the awareness, we also need to converse with them in the different dialects. So our traditional Kala Jatas, so basically they created awareness through in the different languages. It can be Gondi, it can be Lambadi, it can be Marathi. So different kind of languages, we created the awareness on all the healthcare services and all the important aspects of the communicable and non-communicable diseases. The third important challenge was how to reach the remote areas. So particularly in the PVTGs, since they were residing in the remote areas, so how to reach them, in that this Janman initiative, this came into rescue. So under the Janman initiative, we actually put in the mobile medical units. Mobile medical units, as we know, it consists of the entire setup of a doctor, of a paramedical staff, medicines, all the equipments are there. So this helped in ensuring the doorstep delivery of healthcare. So this came in handy because though we had crunch of the healthcare staff, but because of the Janman initiative, we could pool in the healthcare staff and we ensured that the doorstep delivery of healthcare is possible. This ultimately ensured that the diabetes and hypertension as well as sickle cell anemia screening, so all these parameters we were able to achieve 100% screening. What was earlier very low, because of these initiatives and because of the convergence of different schemes, we could achieve 100% screening. The another important challenge was under TB Mukt Bharat Abhiyan, how to ensure that TB screening, particularly of the vulnerable population, presumptive TB screening through X-rays has to be achieved. So we had an X-ray facility which was far away from the block. So we devised the strategy of putting in a portable TB X-ray machine, and because of that, we will be able to ensure the tuberculosis screening of all the 30 plus aged individuals and of all the vulnerable population. This also helped us in achieving good results in the TB screening. Next. Particularly anemia was a challenge in the block. So in order to ensure that how to tackle the anemic cases and how to ensure that weekly iron folic acid administration program is being monitored, we introduced a local app. So we named it as Narnun Monitoring App, and in which ASHAs, ANMs, and all the healthcare staff, so they were basically told to do Thursday visits to all the schools and residential schools. They tracked their visits, and also they posted the photos and the students, how many students they administered the tablets. So this helped in ensuring that this weekly iron folic acid administration tablet program was streamlined, which was very crucial in tackling the anemia. In order to ensure that we provide good diagnostic services, so the health facility in Narnur, it was basically linked to one diagnostic hub, a nearest diagnostic hub. So any kind of screening, any kind of diagnostic results, it was ensured by linking it through a diagnostic hub, a nearby diagnostic hub under hub and spoke model, which ensured that the results are available to the healthcare providers also as well as to the patients also. So this helped in designing an electronic health records and ensuring a data-driven health services. As I told, like earlier, before the start of the aspirational block program, we didn't have any facility related to the NQAS. Actually, the block was not at all aware what is the National Quality Assured Standard facilities. So under the Sampurnata Abhiyan, this was a very key important indicator. So we energized after our staff also. We made them aware what are the NQAS standards, and we then pooled in the funds from different district administration funds and other funds, and we ensured that 2 sub-centers, they are upgraded to the National Qualified Assured Standards also. We installed a blood storage unit. Again, this was installed taking into the consideration of the high anemic cases, because if a severe anemic case is there, then we had to rush that anemic case for the blood transfusion to a very far off facility. But installing a blood storage unit at PHC only, we ensured that any case of blood transfusion is being done at the nearby health facility also. Telemedicine and telegynecology also, we are now planning to launch in the coming days, because specialist services are still we are lacking in the community health center at Narnur. So in order to fill those gaps, we are in talks with NGOs, and we are starting a telegynecology services soon. Other specialist services also, it can be dermatology, it can be physician services, all these specialist services also we are in the loop line to start in the PHC Narnur also. Apart from that, since Niti Aayog interventions, they do talk about the saturation of indicators. But Narnur did need a special focused, tribal focused intervention, and particularly school-based health interventions. So for that, we started a Girijan Poshan Mitra campaign. Girijan Poshan Mitra campaign was started in all the tribal ashram schools. In that, weekly iron folic acid tablets and mahua laddus. So though mahua was a popular fruit, mahua has been a popular fruit in the tribal areas, but the consumption has decreased over the years. So what we did, like we started a unit of the mahua laddu in Narnur block only, and we started supplying mahua laddus from that block to the ashram schools, and now we have expanded to the all KGBBs in the district also. So this has given a very good result. In fact, a mahua fruit has been studied by ICMR also. It's a very good fruit. It's a wholesome fruit. It has macronutrients, micronutrients. It can fill in the gaps of hidden hunger also. So this has given us tremendous good results, and we have been able to reduce severe anemic cases because of this special intervention. For the menstrual health awareness also, as the awareness was very low, so we roped in the NGO, and we ensured that for 1 year, free sanitary pads distribution and installation of vending machines, installation of incinerators, and creating menstrual health awareness also, not just among the girl students, but also among the community. So ultimately, our focus has been to tackle the anemic cases. It can be through iron folic acid supplementation, it can be through mahua laddu, it can be through menstrual hygiene. So this was a challenge in Narnur, which we have been able to address through these initiatives. Next. Talking about the nutrition, particularly for the pregnant and lactating mothers, and also for the children in the Anganwadis. Again, we adopted a multi-tier strategy, again taking into consideration what are the special challenges in the Narnur block. So the government of Telangana has also been supplying a Balamrutam Plus. It's a specially designed product which particularly tackles to the SAM cases. So administration of this Balamrutam Plus, and along with local products, the local products which can be available, the local products which can be created in the Anganwadis and also at the homes also. So it can be through Ragi Java or through Jaggery rice. These all were encouraged to the pregnant ladies, lactating mothers also, as well as the mothers of the children, so that the gap of the severely acute malnourished and all those gaps were filled through this mix of these dietary patterns. We ultimately trained our teachers. So through this Sampurnata Abhiyan and in the initially stages of Chintan Shavits and Sankalp Saptas also, how to ensure that growth monitoring is done properly. We provided the growth monitoring devices. We created training and all provided different kind of charts also to the teachers, so that growth monitoring was also done properly. And because of that only, then we could be able to identify SAM cases, and we provided them this multi-tier dietary patterns, which helped in tracking their consumption as well as in the improvement in the nutrition levels. Wherever, apart from the diet also, if the improvement in the nutrition levels were not introduced, we told them to basically refer it to the nearby health facilities also. So through the monthly medical health checkups at the PHC Narnur or at the referral centers in a tertiary care also, it was again possible because of the convergence between the health department and women and child welfare department. So apart from the nutrition also, because of these medical checkups also, we could ensure that early detection and early response was also given. Giri Poshan was also particularly implemented, taking into challenge for the PVTG habitation. So there we introduced this millet-based diet. It was funded from the district administration only, and Anganwadi teachers, they were clearly trained to ensure that the millet-based diet is given to the PVTG children, and the hidden hunger was tackled, and this introduced that SAM cases, particularly among the PVTG children, it reduced, and the nutrition coverage also increased. Next slide.
You can make it a little fast.
Yes, ma'am. So this talks about the strengthening of the Anganwadi ecosystem. So again, we adopted a convergence strategy. We upgraded the Anganwadi centers and ensured a low-cost solution of sediment filter-based safe drinking water. It's very low-cost solution and also very easy to manage also. Nutri gardens and also through Delta ranking, as our earlier speakers have also told. So in the Delta ranking, in Arnoor aspirational block also got a grant of 1 crore. And through those grants only, again, we adopted the strategies to ensure that there is saturation in indicators. So through that, we are providing indoor and outdoor play materials in order to instill the activity and in order to instill the early childhood education among the children. This is a classic example of Jan Bhagidari. Particularly, there was an abandoned PHC, and when there was no Anganwadi facility in that village, so the people only they came forward, inspired by the commitment of the Anganwadi teacher, and all the people they came forward, they contributed themselves and they made an abandoned primary health center into fully functional Anganwadi center, and afterwards it was also reimbursed by the district administration. And because of these now fully functional Anganwadi centers, all the activities, it can be Poshan Pakwada, Jan Bhagidari activities, they have helped to ensure the maternal child nutrition awareness and other active participation also. Next. Talking about education, we took this novel initiative of model mother school committees. So instead of contractors taking up the school infrastructure repair works, we designed a committee in which the parents, the SHG members, and the village organization, they are the members, and the execution of work was being done by them only to create a sense of ownership and to ensure the quality of work. So this helped us deliver successful results, and now all the high schools have separate girl toilets, the basic drinking water facility, electrification, all the minor repairs, major repairs, etc., all have been achieved because of this initiative and the work done by the model mother school committees. In order to ensure that learning outcomes are improved, though we have some dearth of the staff, so we took the steps of the digital classrooms. So digital classrooms, even if the staff is not there, so through the installation of the digital classrooms and also the support of the CSR partners, so virtual learning and offline digital content access was also ensured, which helped in ensuring the learning outcomes. Also, we have established the science labs and also process our with the establishment of the science labs and the STEM labs. In the few schools, it has energized other schools also to take up these labs, and with the help of the Niti Aayog grant in it, we are also establishing more labs in the other schools also, which will help in improving the learning outcomes. Next. So, in order to ensure that the outcomes and the learning outcomes, particularly in the 10th standard and all other English literacy programs also, we designed the special academic programs also. The government had introduced English medium. So after the introduction of English medium, there was a challenge among the 10th grade students how to have good scores. So we designed a specific coaching for the 10th grade students, again with the help of some NGOs, and we were able to conduct it successfully, and accordingly it ensured that those earlier when the 10th scoring was below 60%, now it has increased to 80%, and in the coming days we are hopeful to make the scoring better also. Badi Bata program, again it involves all the communities, all the parents, village elders and teachers. So this is a door-to-door step enrollment drive which ensured that enrollment has increased. Now actually there is a demand in Narnood block. Earlier when the schools had been closed, now the demand is coming among the community only, through the community only, to reopen the schools. And this academic year also we have been successfully able to reopen the schools and increase the enrollment in the government schools also. In particular, tribal welfare primary schools, which particularly deal with first to second standard only. So their benches facility was not there. So introduce the Shishu benches also. That is also a novel concept. Low height Shishu benches, which helped in improving the student learning environments as well as ensuring the greater enrollment and retention. For the English, particularly for the English speaking, English reading, listening and writing, we introduced different programs across different grades with the help of the NGO. It was again a data-driven decision making. First, early assessment was done before the start of the program. What were the student levels that were judged, and according to the different levels, it can be poor performers, it can be good performers, it can be aspirants. Accordingly, we designed the specific strategies as per the grades, and we have also seen wonderful results. It can be in the vocabulary improvement, it can be in the debates, and it can be in the young oratory clubs. These all we have undertaken to ensure that there is language proficiency, because generally students, they speak in the local dialects. English awareness is very less, so that is also very important. Recognizing this need, we undertake this program. Inclusive education also, and for the well-being of all, we undertook the different initiatives. It can be health day, 6-day wellness school initiative programs. Food committees were formed, particularly to ensure that there is quality food service delivery. For children with special needs also, we targeted and we roped in the special educators and also inclusive education resource persons. Because of that, the children with special needs enrollment has also increased. And now we are also providing the special aids in those children with special needs centers called as Bhavita centers. Apart from that, in the PM Shri schools and all other residential schools, with the convergence of funds, we have organized the experiential learning exposure to the different facilities. It can be in Maharashtra also, it can be Hyderabad also, so that this is encouraging the students to show the interest towards innovation and entrepreneurship, and also towards the other areas. Next. Agriculture was also a challenge, particularly in different key performance indicators. So in all the key performance indicators, it can be in the PM Kisan direct benefit transfers, it can be in the soil health cards. Through the involvement and through making our staff aware about all these key performance indicators, we ensure that 100% saturation has been achieved. The two important things which was done is farmer producer organizations were energized. So there were 2 farmer producer organizations which were energized, they were established, and they had started running a ginning mill in Narnur only. So earlier the ginning mill and earlier the procurement centers, which were far off in the other mandal headquarters, other block headquarters. Now because of these ginning mills and procurement centers running in Narnur only, farmers, they are facing good accessibility to the markets. Their transport cost, their logistic cost, all has reduced, and they are getting a better price. Also, it has ensured the credit linkage. So instead of going to the money lenders, now they are getting the credit linkage through the FPOs. So this has also reduced the interest burden, because outside money lenders, they charge very high interest rates, but compared through these FPOs, the interest rates have also reduced, which has ultimately ensured that the farmers' incomes are increased. We have taken initiatives to promote organic and sustainable practices also through biofertilizers and through vermicompost, with the help of NGOs and other technology partners like Krishi Vigyan Kendras. Oil palm has been a big success in Narnur block, because cotton is a single crop which is grown throughout the entire Kharif season, but multi-cropping has been introduced through the oil palm, and which has ensured that more farmers, now they are coming forward and taking up the oil palm plantation. We are also planning to take up a LAC FPO. So Lakka is a product which was earlier prevalent in Telangana. But over the years in Adilabad district also, this LAC production has decreased, but the demand is there. So with the help of the Niti Aayog grant and aid and the Prime Minister award, we are ultimately taking up this task also, and we will be establishing a LAC FPO. This revolving fund will be there, and we are planning to take up it with around 300 families, around 6,700 trees. So after the brooding of the LAC, we are hopeful that over a period of 1 year, each and every family will be earning an amount of 50,000 to 60,000. So this will also help in increasing the farmer incomes. Next.
Rajshri, you may like to conclude.
Sure.
Yes, right?
So talking about the water resilience, these all steps we have taken through farm pots and check dams and other initiatives. We have also adopted a novel 3-tier farming, which also it has been started in 90 acres, and more farmers are coming forward. Next. SHGs have been a pioneer, and they have been the main change agents in the Narnur success story. So it can be through the revolving fund, and it can be through the convergence of different schemes. Particularly, state government is also providing interest-free loans, which has encouraged the SHGs to open the different enterprises. Under the Vocal for Local initiative, we have started Mahua Laddu project also. So earlier, in the start, when only 20 kilograms monthly sale of Mahua Laddu was happening, now the sale has increased to 150 kilograms in a month. So this has been a huge success, not only in Adilabad district and Adilabad town, but we are now supplying it to Hyderabad and other districts also. Next. For the digital divide, as I told, like there are many remote habitations. So we thought to start the model CSCs at the different junctures wherever it's needed. And through the convergence of the Prime Minister Employment Guarantee Program, this model common service center has been started. One has been started, one is again in operational. This novel initiative of grievance redressal, again through the use of technology. Daily grievances are being accepted at a portal created at the block office, and monthly public hearing is also being undertaken. We have opened a website also where the real-time information is available in the different languages, and this has ensured that key performance indicators are being tracked and transparency is being promoted. Next. So these all initiatives are in underway with the support of Niti Aayog also. And drinking water also, though we have ensured the 100% functional tap water connections, but still there have been some challenges in few areas. So we have devised the strategies and installed the RO plants, and also in the schools and habitations also. Through Jal Utsav campaign also, we created awareness, and through the convergence with EGS and other funds also, we have ensured that throughout the year, sustained water supply is being ensured. Next. This I was talking about. Through the support of Niti Aayog, we have taken up the tank desiltation project also, which has been completed successfully. It has ensured that the storage capacity of tanks are increased, and the farmers, they receive the good quality of silt, which has again improved the soil health also. Under the Jal Sanchay, Jal Bhagidari also, different water body restoration, recharge activities have been taken up, which are
Please conclude,
visible.
Rajeshri, you may like to conclude, please.
So, because of Narnur has been a water stressed block also, the groundwater extraction level has been high also. So, because of that, we have taken the different initiatives, and we have ensured that in terms of the drinking water access, in terms of the irrigation access, irrigation water access to the agriculture, different initiatives have ensured that there have been improvement in indicators. However, for the way forward, we need to improve upon other two sectors of the basic infrastructure and social development also. With the support of Niti Aayog and with the convergence of different schemes and different stakeholders, we are hopeful that our journey will be successful in the coming days also. So I would like to again thank the entire team of DARPG and all the senior officers for providing me this opportunity. Thank you.
Thank you, Team Narnur, and we can feel the passion, we can feel how the involvement in the micro-planning, and how with micro-planning and Jan Bhagidari, they have taken development rooted in, local traditions and customs, making it more sustainable, continuous, with ownership by the community. With these, they may carry on with this good work to achieve whatever is remaining of in the district, in the block. And now I would like to call upon Shri Wahid A, DC and DM of